Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 16th of February 2022. Numbers wise, we're seeing a progressive improvement in that the numbers are coming down. About this time a month ago, we were looking at 170, 180 COVID positive patients in the hospital. Today it's 34. That's within 10 days of their first positive diagnosis, as we've reduced that from 14 days to 10 in line with national guidance. Of the 34, 29 patients are in our general beds, 3 patients are at Clifton and 2 patients are in critical care. It is a reminder still that some people get very, very poorly with COVID. It is still a dangerous illness potentially, even though the prevalence is falling and in general because of Omicron and because of vaccination, of course, not so many people are poorly, but some really are. So it's still really an important issue. We've had 5 deaths this last week of patients who are within 28 days of their first COVID positive test. So as ever, commiserations, condolences to families and loved ones of those people. It is important that I say this again, that those patients have passed away with COVID, and we have to do further analysis to work out whether COVID was the major component in that. So there is a difference to be thought through about whether people passed away with COVID or of COVID. As I say, that requires further analysis. The community numbers are improving too, so Blackpool 441 per 100,000, Fylde 371 and Wyre 420. So the community numbers are falling at a good rate, and I guess we hope that because it's half term this week, we will see a little bit less transmission between school age children, and that should help these numbers to come down. Of course, we'll have to monitor that again when the schools go back. Testing is still a really important part of the story, and for anyone who is at risk of COVID, and by and large now people know if you're in an immunocompromised group, the point about the testing is that there are medications available through the NHS which are proven to be effective. They're antiviral medications, antibody medications, which help keep people out of hospital. So it is still worth doing a lateral flow test if you think you might be positive. So if you've got any flu-like illnesses or you've been in touch with someone who you know is COVID positive. And if that lateral flow test is positive, then of course you still do need to self-isolate, but also get a PCR test done. And it's the PCR test that then connects you into the NHS system, who will be in touch with you if they think you meet one of the at-risk groups and would benefit from these medications. It is still the case that vaccination is thought to be the most important part of the story here. And although the vaccination rates have progressively improved, and of course we're vaccinating school-age children now, there are still some gaps in that. And my point is it's not too late. So if you haven't started a course at all, you can start it. If you've not had your second jab, you could get that. If you're due a booster, it's still worth doing. Although Omicron looks like it's fading out, we really don't know whether there'll be another variant which might be more dangerous. So the best protection that we can see is vaccination. And still, I would urge people to stay up to date with the vaccination programme as much as possible. Whether there'll be a 4th booster and so on and so forth is not clear at this stage. We could probably guess there'll be one come the end of the summer into winter 2022, but it's too early to say. And just finally, in line with what I've said about numbers, we've basically reintroduced visiting at the hospital. So we've still got restrictions as far as our accident and emergency department is concerned. And that's really to do with the risk of overcrowding and then transmission. But as far as the rest of the hospital is concerned, we've relaxed visiting. We're still asking really for just individual visitors, and the detail is on the website. We will ask you to wear a mask, of course, course, when you come into the hospital, and ideally we would like you to have tested your own lateral flow test at home before you come in. But I think by and large we'd all agree it's a step in the right direction to be reintroducing visiting and try and get us back to as near normal as possible. I think we're still going to be wearing masks and abiding by strict infection prevention and control measures within the hospital for quite a few more months to come. So please be understanding of that if you come on site. That's all for today. See you next week. Thank you.